Hi everyone, in today's video, we're going to go over CBA practice questions in unfolding case scenarios. And this is what you can expect during your CBA assessment. And let's get started. Here's your first case scenario. Mr. De La Cruz, a 56-year-old client, had a THR or total hip replacement yesterday. He is obese, smokes 1 pack per day, and has a history of hypertension. 2 hours into your shift, he suddenly reports shortness of breath, chest pain, and anxiety. His oxygen saturation is 84% on room air, heart rate 124 beats per minute, blood pressure 92/58, and respiration rate is 32 breaths per minute. Your question is, what is the nurse's priority action? You can pause the video here, choose the right answer, and just get back to the video again once you have your answer. Alright, for this question, we're looking at the classic PE or pulmonary embolism, right? Looking at the question, notice how it's asking you what's your priority. So that means you can only choose one, and it's asking you what would be the most important thing that you need to do for this patient. And as nurses, we have to think about our ABCs: airway, breathing, and circulation. So looking at your choices here, without oxygen, the client won't survive for very long for any other intervention. So the right answer here would be letter B. Place the client in high Fowler's position and administer oxygen. This client is showing classic signs of pulmonary embolism. So look at the symptoms again: shortness of breath, chest pain, and anxiety. And pulmonary embolism is a life-threatening condition for patients who undergo orthopedic surgery. For your CBA assessment, it's not about memorizing theory. It's not about memorizing facts. It's about applying your knowledge in realistic case scenarios, using critical thinking, and deciding what are the priority nursing actions based on the patient's signs and symptoms. Priority nursing action here would be place the client in high Fowler's position and administer oxygen. After doing that, that's when you can notify the healthcare provider immediately. As you can only choose one answer, letter B and letter A are correct, but it's asking you what is the priority? What do you need to do first? All right, for this next question, again, this is unfolding case scenario. This is what you can expect during your CBA. So one case scenario, and you'll get multiple questions about that same case scenario. Which of the following placed Mr. De La Cruz at increased risk for developing a pulmonary embolism? And this is a select all that apply question. A, recent orthopedic surgery, B, smoking, C, hypertension, D, obesity, and E, high fiber diet. In this select all that apply question, it is testing your ability to identify what are the realistic risk factors that is related to pulmonary embolism. If you're looking at hypertension, someone might think, oh, that's a big health issue. That's probably a high risk factor. But you need to remember, go back to the question, it's asking you for pulmonary embolism. So although hypertension is a cardiac issue, it is a big health issue, it is not significant to pulmonary embolism. The answer here would be letter A, letter B, and letter D. So when you're answering risk factors, always go back to the pathophysiology. Just because one of the option, you might think it's a big health issue, that's automatically a risk factor. You always have to go back and ask yourself, does this directly contribute to the disease or the complication that is being asked? So in this case, the pulmonary embolism. And here's our next question. After oxygen is applied, the client remains restless, the patient has tachypnea and hypotensive. What is the nurse's next best action? Prepare to administer IV heparin as ordered, begin chest compressions, insert an NG tube for decompression, or D, place the client in Trendelenburg position. For this question, again, we're doing an unfolding case scenario, right? The question is telling you that you have already applied oxygen, but the patient is still having all the symptoms. Now, what do you need to do next? Basically, that is the question. So notice how the sequencing here is very important. First, you have stabilized your patient, right? You have stabilized your patient with oxygen. The next thing you need to do, because the patient is stabilized, the patient has oxygen already, you need to address the cause. What is happening to the patient? The patient is having pulmonary embolism. The patient has clot formation. And that's why the nurse's next best action, your best action here, is to give the patient and administer IV heparin as ordered. Something that you also have to remember for NCLEX, when you're doing your NCLEX or CBA assessment, assume that we are in a perfect world, we are in a perfect hospital, you have full staff of physicians and nurses, nursing assistants, and also you have orders already given to you by the doctor. So medications are already prescribed. So when you are looking at your options and medications is one of the option and it says give this medication or administer this medication as prescribed, you can assume that there's already a prescription for that, so you can just easily administer that medication. So that means you don't have to call the doctor to verify the order. You already have the order. For this question, the answer would be prepare to administer IV heparin as ordered. Again, we are doing it step by step because we are doing an unfolding case scenario. So we need to look for the intervention that will prevent the progression of pulmonary embolism and that will give an immediate stabilization for this patient. And letter B, chest compressions, it's not needed unless the patient is having a cardiac arrest. We don't have to put NG2. And letter D is not advisable if you want to put the patient in high Fowler's or semi-Fowler's in this situation. Which clinical findings should the nurse monitor closely to evaluate worsening pulmonary embolism? And again, you have a select all that apply again. Letter A, jugular vein distension or JVD, decrease SpO2, increase shortness of breath, bradycardia, and hypotension. Now, for this question, it's pushing you to connect the dots, connect your assessment findings with what's happening to the patient physiologically. And the answer for this question would be letter A, letter B, letter C, and letter E. Letter A, jugular vein distension, indicates that there is a strain on the right side of the heart. Letter B, it is showing hypoxemia for this patient. Letter C, increased shortness of breath. That's a classic progression of pulmonary embolism, so you will see that with patients having PE. Letter D, that's not the right answer, that's wrong, as that's not expected. It's usually tachycardia for PE, for pulmonary embolism. And letter E, hypotension, that is signaling that shock is happening and the patient's condition is getting worse. You see hypotension, that's warning for you, that's alert, something is happening, the patient is getting worse and you need to do something. All right, let's go to our next case scenario. For your next case scenario, you have Mrs. Singh, a 72-year-old client, admitted from a long-term care facility with confusion, fever 39.2, and the patient is lethargic. She has a urinary catheter in place, vital signs 118 beats per minute, blood pressure 88/54, resp 28 per minute, SpO2 is 90% on room air. On assessment, the patient is disoriented, skin is warm and flush, and urine output is 15 mL per hour. Question, what is the nurse's priority action? Increase IV fluids as prescribed, administer acetaminophen for fever, apply 2 liters nasal cannula oxygen, or notify healthcare provider. All right, what do you guys think is the right answer here? Let's discuss it together. This is a tricky one in terms of asking for the priority action because when you're looking at the patient's oxygen, right, 90% on room air, We might think, oh, oxygen, but remember that in septic shock, the problem is not oxygenation, the problem is perfusion. And the question is asking you what is priority, and you can only choose one. When it's asking you for priority action and it's multiple choice, that means you have to choose the best answer. When you're doing NCLEX or CBA questions, there would be times that two answers would be very close together, like two answers are correct. The trick is choosing the best one. Therefore, the answer here would be letter A, increase IV fluids as prescribed, because without fluids, oxygen delivery is compromised. So we have to deliver oxygen. When we increase that IV fluids, there is high possibility that the oxygen will also increase. And that's why the priority, because we can only choose one, the priority would be letter A, right? Increase IV fluids as prescribed, as this patient is showing signs of septic shock, hypotension, tachycardia, tachypnea, altered mental status, and oliguria. Those are all signs of septic shock. When medication is part of your options as your ABCD, assume that you already have an order, so you don't have to call the doctor to get an order because it's already prescribed, right? It says that as prescribed already. So you can call the doctor after you've given that medication, after you have provided intervention. All right, let's go to the next question. Which of the following findings support the diagnosis of septic shock? And this is a select all that apply. A, hypotension unresponsive to fluids. B, decreased urine output. C, confusion and disorientation. D, bradycardia. And letter E, elevated lactate levels. In this select all that apply question, it's asking you to recognize what's the systemic impact of shock, right? So it's going to affect the brain, it's going to affect kidneys, it's going to affect tissue perfusion. So the right answers here would be A, B, letter C, and letter E. Hypotension, decreased urine output, confusion and disorientation, and elevated lactate levels. We're not going to choose letter D, bradycardia, because if you guys can recall, for early shock, what you can expect is tachycardia, not bradycardia. All right, let's go to the next question. After IV fluids are started for your patient, the client still remains hypotensive, 82/50. What is the next best action? Basically, the question is telling you that you have already started IV fluids, but it's not working. Since it's not working, you need to do something else. So what is the next best action? A, administer prescribed norepinephrine infusion. B, increase the acetaminophen dose. Letter C, insert an indwelling urinary catheter. Or letter D, provide oral fluids. Best next thing that we need to do, we need to escalate care now. We need to move to vasopressors. So letter A, administer prescribed norepinephrine infusion. With norepinephrine, it's the first line vasopressor for shock, for treating septic shock, more specifically because it will increase the blood pressure as it will constrict the blood vessels, and that will also improve organ perfusion, which is the issue with septic shock. And our last question for today's video, which interventions are needed in managing Mrs. Singh's septic shock? Again, select all that apply. A, administer broad-spectrum IV antibiotics as ordered. B, monitor urine output hourly. C, administer IV corticosteroids routinely. D, maintain blood glucose. Letter E, initiate BVD prophylaxis. In this select all that apply question, it ties in for our sepsis bundle. They do antibiotics, IV fluids, monitor the urine, and also blood sugar or glucose control. Also, a test tip for you, if you look at letter C, it says, administer IV corticosteroids routinely. When you see the word routinely, always, every time, when you see those words, be very careful in choosing those, because basically what it's telling you is this is something that you have to do in every case scenario, always, all the time. And nursing exams like CBA and NCLEX, they don't like those. They don't like absolutes. They don't like the word always, routinely, every time, unless it's about patient safety. The answers here would be letter A, letter B, letter D, and letter E. For IV antibiotics, we have to start that right away. That's something that you have to do. For septic shock, you have to start IV antibiotics within an hour of recognition that the patient is having septic shock. Letter B, monitor urine output, is an indicator of perfusion and organ function. Letter D, maintain blood glucose or blood sugar less than 10.0. We want to prevent hyperglycemia incidents or complications. And letter E, initiate DVT. Prophylaxis is recommended since immobility and sepsis can increase the risk for clotting. And that's it for our practice questions for today. I hope you guys found that helpful. If you enjoyed this video and you want me to create more videos like this, let me know in the comments below, and don't forget to like and subscribe. And if you need more assistance with your CBA and your SLA preparation, don't forget to visit my website www.nursingcollective.co for more nursing resources, study materials, and CBA SLA preparation course that I've created specifically for IEN like you. Thank you for watching, and I'll see you in the next video. Bye! If you found this video helpful, please support the channel by liking, subscribing, and hitting the bell for future videos. Drop a comment below as well to share your thoughts, ask questions, or suggest any future topics. I would love to connect with you. See you in the next video!